I'm Bryann Bromley, and I would like to thank Dr. Abu Hamad for inviting me to this course. Like the rest of the speakers, I really wish things were different and that we were all in Las Vegas together. But I'm very grateful to the organizers of this symposium for being able to present this meeting on a virtual platform during this pandemic. And I just wanted to share an image of the flyover at my hospital at the Massachusetts General Hospital in Boston. So I have no disclosures to make. However, because I will be talking about practice parameters, I would like to bring out that I am on the executive committee of the American Institute of Ultrasound and Medicine and serve as president of the Perinatal Quality Foundation. So what are our objectives today? I would like you to be able to understand the importance of following a standardized anatomic imaging protocol in the first trimester. You should be able to recognize the available practice parameters for the evaluation of the fetus, but this talk is going to really focus on the AIUM standard practice parameter and the AIUM detailed practice parameter in the first trimester. Your syllabi will have the ISWAG practice parameter, which was put out as a guideline in 2013, and the German variation, which was released in 2016. By the end of this presentation, I hope you're familiar with the required components of the detailed first trimester fetal anatomic and placental assessment protocols. So why bother with a standard protocol? Many very good practices will say to me, oh, I look for as much as I can see. And yeah, I'm picking up a lot of anomalies. However, we know that in a systematic review and meta-analysis for the detection of anomalies in the first trimester, the pooled detection rate for abnormalities, all abnormalities, was 32% in the low risk or unselected population. We picked up 46% of major abnormalities in this population, and we jumped to 61% overall in those at increased risk for structural abnormalities. However, what we know is that the use of a standardized protocol increased the detection rate of anomalies in both high risk and low risk population. We improved our detection rate by following a protocol. And why is that? That's one of the basic things about screening. For example, if you're looking for a bladder and you see it, great, that's awesome. But if you can't, well, you might say, I tried. But you might as well not try, because if you don't see a bladder, you need to follow it up, because your detection rate will be the same as someone who doesn't even look. And that's why we need to follow a standardized protocol.